Welcome to this week's Al-Ghaf Dynamics Health Connect Middle East podcast episode. This week, we will again be discussing major developments and events over the past 7 days in the Middle East region across healthcare, public health, life sciences, and wellness. As always, you will hear trends, insights, and the latest developments across the Middle East region for the week leading up to September 4, 2025. Our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets through our internal data and analytics platform, Health Connect Middle East. Over the past week, the Middle East's health sector spotlighted a mix of ambitious reforms, innovative research, and pressing humanitarian crises. Gulf countries pushed forward with bold healthcare initiatives, from policy shakeups and digital health transformations to biotechnology partnerships, underscoring their Vision 2030-style commitments to world-class care. Meanwhile, conflict-affected areas grappled with severe public health challenges, revealing stark regional contrasts. In war-torn zones like Gaza and Yemen, basic survival and disease containment dominated the agenda, even as neighboring states offered support. Across the region, a unifying theme was the drive toward prevention and wellness. Governments and institutions launched campaigns targeting safer lifestyles, chronic disease management, and stronger health systems. The following sections detail key developments by topic, highlighting both the strides in health innovation and the ongoing struggles in public health. Healthcare policy and government initiatives is our first topic. Kuwait restricting expat healthcare access. In a major policy change, Kuwait's Ministry of Health issued a decree barring temporary visa holders and visitors from using public healthcare facilities. Effective immediately, non-residents are excluded from government hospitals, specialty centers, and primary clinics, a move aimed at conserving public resources. This marks a strict new approach to health access, modifying Kuwait's protocol so that only citizens and long-term residents can avail state-funded care. Jordan, tackling unhealthy food marketing. Jordan convened policymakers, health experts, and civil society on August 31 in Oman to advance a national food labeling policy that curbs marketing of unhealthy foods to children. Under the patronage of the health minister, the workshop laid groundwork for scientific nutrient profiling to inform stricter labeling regulations. The effort underscores Jordan's commitment to combat childhood obesity and diet-related disease through stronger government oversight on food industries. Oman School Health Strategy. Oman's Ministry of Health unveiled an integrated student health plan for the new 2025 to 2026 academic year to boost youth wellness in schools and universities. The strategy mandates comprehensive medical checkups for students in key grades, vision hearing screenings for early detection, and enhanced health education programs for students, teachers, and parents. Universities will expand services like youth counseling, mental health support, and first aid training. By creating a safer educational environment and promoting healthy lifestyles from an early age, Oman aims to improve academic achievement and long-term well-being. Egypt, clamping down on illegal clinics. Egyptian authorities moved decisively against unlicensed medical facilities. The Health Ministry announced the closure of 16 private addiction treatment and psychiatric centers in Cairo's Makatam district after joint inspections uncovered grave violations, unqualified staff, lack of licenses, even possession of narcotics. The offending centers were shut and referred for prosecution. Officials stressed that patient safety is paramount and vowed to continue nationwide crackdowns on illicit clinics. This enforcement push aligns with Egypt's broader efforts to regulate health services and protect vulnerable patients from malpractice. Next is life sciences and research innovation. Qatar genomic newborn screening. Qatar achieved a regional first in precision medicine. Sidro Medicine in Doha partnered with the Rady Children's Institute, USA, to launch a genome-based newborn screening program. Announced on August 20, this research initiative, Begin NGS, will use rapid genomic sequencing to screen infants for hundreds of treatable genetic disorders at birth. By detecting rare metabolic and monogenic diseases within days of life, clinicians can intervene early to prevent severe illness. CIDRA's program, the first international site of this consortium, is expected to shorten the diagnostic odyssey for affected families and establish new models for preventive genomics in the region. Israel lab-grown kidney breakthrough. Israeli scientists reported a milestone biomedical discovery. A team from Sheba Medical Center and Tel Aviv University grew a long-lasting 3D human kidney organoid in the lab, maturing a synthetic mini-kidney to the equivalent of 34 weeks gestation. This world-first achievement, published in the EMBO journal, provides the purest and longest-lived kidney tissue model to date. Researchers can now observe human kidney development, live, and gain insights into congenital kidney diseases. The breakthrough opens doors to improved understanding of renal disorders, innovative treatments, and even future regenerative medicine approaches such as lab-grown organ tissue for transplantation. We move on to biotech and pharmaceutical developments. Egypt, UAE, China, Vaccine Production Alliance. Egypt took a significant step toward vaccine self-sufficiency by signing a trilateral memorandum of understanding with a UAE investment firm and China's Red Flag Biotech. Under the deal, Egypt's state vaccine company, Vaxira, will expand domestic production of human and veterinary vaccines and develop plasma-based therapies, leveraging foreign investment and technology transfer. The partnership is strategically designed to position Egypt as a regional vaccine manufacturing hub for African and Arab markets while ensuring local supply of critical vaccines. Egyptian officials lauded it as a major boost to national health security and innovation capacity in biotechnology. Jordan, Saudi Arabia regional biologics manufacturing. In a bid to localize cutting-edge therapeutics, Oman-based MS Pharma partnered with Pol Pharma Biologics to introduce advanced biosimilar drugs in the Middle East. Announced September 2, the licensing agreements will bring treatments for gastroenterology, neurology, and dermatology, biosimilar versions of vedolizumab, ocrelizumab, and guselkumab, to MENA markets. Notably, MS Pharma has established the region's first biologics fill and finish facility in Saudi Arabia to support this effort, marking the first biologics manufacturing center in the Middle East. The collaboration underscores a broader trend of regional pharma growth. By producing complex biologic medicines locally and working with global developers, Middle Eastern firms aim to expand patient access to affordable treatments and build a homegrown biotech industry. UAE brain cancer therapy investment. The UAE continue to attract biotech ventures. In Abu Dhabi, Eniong Technologies, a U.S. clinical stage company, incorporated a regional subsidiary, NeuroMENA, on August 6, backed by a $50 million investment from local partner Qatar. This move will fund late-stage development of Eniong's experimental brain cancer therapies and demonstrates the Emirat's commitment to life science innovation. The Abu Dhabi Global Market, ADGM, registration provides Eniong a base to conduct trials and eventually manufacture advanced neuro-oncology treatments in the Middle East, aligning with the UAE's strategy to become a regional biotech hub. Public health challenges and disease outbreaks are up next to discuss. Gaza, famine and disease crisis. The humanitarian health emergency in Gaza worsened alarmingly. Local authorities reported that 185 Palestinians died from hunger in the month of August alone amid a wartime blockade that has created famine conditions in parts of the territory. Hospitals are also contending with an unprecedented outbreak of Guillain-Barré syndrome, GBS, a rare paralysis-causing disorder. Since June, 94 GBS cases have been documented in Gaza, 10 of them fatal, whereas previously the syndrome was almost unheard of there. The World Health Organization warns it has run out of critical supplies needed to treat GBS due to the blockade. Gaza's stock of IVIG immunotherapy and plasmapheresis filters is exhausted, leaving doctors effectively without treatment options for new cases. Health experts link the GBS surge to deteriorating sanitation, malnutrition, and post-infection complications in the enclave's population. Overcrowding, unsafe water, and rising child malnutrition are compounding risks, with tens of thousands of children and pregnant women severely undernourished. Gaza's health system, battered by nearly 2 years of war, is on the brink of collapse under these combined strains. Aid to Gaza's health sector. As Gaza's crisis deepened, regional aid continued. On September 4, the United Arab Emirates sent a large humanitarian convoy into Gaza through the Rafah crossing, carrying desperately needed medical supplies and food. The shipment included 16 truckloads of UAE-donated medicines, for solutions, ventilators, dialysis machines and other life-saving equipment consigned to the WHO for distribution to Gaza's hospitals. The convoy also delivered essential hospital furniture, advanced beds, stretchers, wheelchairs, and cold chain storage for vaccines. An additional 7 trucks brought staple food items to combat acute malnutrition. Part of the UAE's ongoing Operation Chivalrous Night 3 relief effort, this mission exemplifies the region's support to alleviate Gaza's suffering and bolster its collapsing health services. Israel polio outbreak alert. Israel's Ministry of Health declared a circulating vaccine-derived poliovirus type 1, CVDPV1, outbreak in late August after environmental surveillance found genetically linked poliovirus strains in multiple sewage sites. Between February and July, 9 positive samples were detected across Jerusalem and central districts. No human polio paralysis cases have occurred, and Israel's population immunity is high, 98% IPV vaccine coverage nationally. However, the virus is circulating in pockets of under-vaccinated, vaccine-skeptic communities, prompting authorities to heighten immunization efforts. The WHO assesses the risk of international spread as low but is supporting Israel's response. Notably, Israel had earlier this year stopped using oral polio vaccine, OPV, in favor of the inactivated shot, meaning the virus likely evolved from prior OPV use. The incident underscores the importance of maintaining immunization and monitoring even in polio-free countries. Cholera in Yemen and Sudan. Fragile states in the region continue to battle major cholera epidemics. Yemen remains the world's largest cholera hotspot, having borne 35% of all global cholera cases and 18% of related deaths as of late 2024. In 2025, the water and sanitation crisis amid Yemen's conflict has kept cholera transmission high, with aid agencies warning of a looming health disaster without more international support. Similarly, Sudan is facing a nationwide cholera outbreak in the chaos of its civil strife. From January up to mid-August, Sudanese authorities reported nearly 48,800 cholera and acute watery diarrhea cases and over 1,000 deaths across all 18 states. The majority of infections have concentrated in Khartoum and a few other provinces, and cholera has spread into every Darfur state. Response efforts are hampered by insecurity and displacement. These outbreaks highlight how conflict and collapsing infrastructure in parts of the Middle East-North Africa region are dramatically reversing gains in infectious disease control, calling for urgent humanitarian and public health interventions. Now let's shift to wellness and health promotion. UAE Summer Without Accidents campaign. The UAE mounted a seasonal wellness campaign focused on public safety and heat-related health. The Ministry of Health and Prevention, MOHAP, in partnership with the Ministry of Interior, rolled out a Summer Without Accidents nationwide awareness drive to promote preventive measures during the high-risk summer period. The campaign delivered field education programs across the Northern Emirates on topics such as road travel safety, hydration and heat stroke prevention, and safe behavior for drivers and families. Officials emphasized simple but critical habits, carrying first aid kits, taking breaks on long drives, staying well hydrated, and never leaving children or medications in parked cars. By encouraging healthy choices and caution during travel, the initiative aims to reduce traffic injuries and heat-related illnesses. These efforts align with the UAE's National Strategy for Wellbeing 2031, reinforcing a prevention culture as a daily practice to safeguard community health and ease burdens on the healthcare system. Arab Health Day. Regional solidarity. Middle Eastern countries marked Arab Health Day on September 4 with calls to strengthen cooperation in healthcare. In the UAE, the Frontline Heroes Office issued a message joining the Arab world in celebrating the annual occasion, which commemorates the founding of the Council of Arab Health Ministers. The observance was an opportunity to renew collective commitment to advancing the Arab health sector's capabilities and quality of care. UAE officials lauded the contributions of healthcare professionals, frontline heroes, whose dedication underpins national health systems and community well-being. They highlighted how UAE medical teams even extended humanitarian aid abroad, for example, supporting Gaza's healthcare during the crisis, as an embodiment of the nation's values of giving. Similar Arab Health Day events and statements in other countries underscored themes of regional unity in public health, knowledge sharing, and the importance of continuous investment in health promotion for the benefit of all Arab communities. Mental health and wellness initiatives. Several countries advanced initiatives to promote mental and social well-being. In Saudi Arabia, the Health Ministry this week spotlighted its ongoing quality of life programs under Vision 2030 that integrate physical and mental health, from expanding sports and recreation facilities to new mental health clinics. The UAE's well-being agenda also continued apace, with community events and media campaigns emphasizing fitness, nutrition, and work-life balance. Digital health innovation, always a key fascinating area to discuss. Saudi Arabia AI-powered licensing system. In a quiet yet significant digital transformation, one of Saudi Arabia's largest healthcare regulators has implemented an AI-driven platform to streamline medical licensing and credentialing. Historically, doctors and nurses in the kingdom faced weeks-long, paper-based approval processes for licenses and classification. Over the past year, as part of the Vision 2030 reforms, the agency integrated its once siloed online systems and introduced an AI engine to evaluate qualifications and automatically assign practitioner classifications. As revealed on August 4, the results have been dramatic. Licensing decisions that used to take days or weeks are now completed in minutes, with improved accuracy. Skilled graduates no longer wait in bureaucratic limbo, and staff workloads for document checks have eased. This digital backbone upgrade, built on open-source integration tools to avoid vendor lock-in, exemplifies Saudi's push to reinvent health administration through technology. It not only enhances operational efficiency but also supports the rapid scale-up of healthcare services for a growing population by freeing up human resources and reducing administrative bottlenecks. Bahrain. Toward a unified e-health platform, Bahrain accelerated efforts to create a national unified health data platform as part of its digital government strategy. The envisioned Digital Health Integration System, DHIS, will connect hospitals, clinics, and government entities on a single platform for seamless sharing of electronic medical records and health information. Authorities expect this interoperability to yield multiple benefits: faster, data-driven care decisions, elimination of redundant data entry, and significant cost savings through efficiency gains. Bahrain's ongoing e-health initiatives, such as the nationwide iSeha electronic health record network and the Sehati patient portal and app, have already laid the groundwork. During COVID-19, Bahrain demonstrated the power of digital tools, e.g. its Be Aware app enabled contact tracing, teleconsultations, and vaccine appointments. Now, by investing in a unified health information exchange and partnering with tech providers, Bahrain aims to institutionalize these advances. The country also chaired meetings with other Arab states to formulate a regional Arab strategy for digital health, indicating a leadership role in cross-border health IT standards and collaboration. Telehealth and apps regional expansion. Across the Middle East, digital health services continue to expand. Gulf countries in particular are leveraging mobile apps and telemedicine to broaden access. For instance, Saudi Arabia's Sehati platform, Ministry of Health, has facilitated millions of virtual doctor consultations, allowing patients, even in remote areas, to receive care via smartphone. The UAE's government health apps, such as Dubai's DHA app and Abu Dhabi's Malafi HIE, now integrate appointment booking, prescription refills, and lab results, simplifying the patient experience. In Qatar, officials noted that telemental health services and video consults remain in high demand post-pandemic, leading to plans to incorporate these permanently into public primary care. Additionally, the use of AI chatbots for basic triage and patient queries is on the rise in hospital systems from Riyadh to Cairo, improving responsiveness. This week saw no singular launch, but collectively these developments highlight an ongoing digital health revolution in the region, one that is breaking down barriers of distance and time to deliver care more conveniently and intelligently. Hospitals had quite a lot of activity to discuss. UAE Academic Medical Network. In the United Arab Emirates, a major hospital group entered a pioneering training partnership. Sheikh Khalifa Hospitals, a network of 4 government hospitals across the Northern Emirates managed by the UAE's Pure Health Group, signed an MOU with Ras Al Khaimah Medical and Health Sciences University, RAKMSU, to provide advanced clinical training for medical students. It is the first agreement of its kind spanning all facilities in the Sheikh Khalifa Hospitals network, which together encompass nearly 600 beds and over 2,500 healthcare staff, including 630 physicians, across Al Quwain, Ras Al Khaimah, Ajman, and Fujairah. Under the deal, Raqamsu students will rotate through these hospitals' modern wards and clinics, gaining practical experience and mentorship from seasoned clinicians. The collaboration aims to better bridge academic learning with real-world practice, nurturing a new generation of Emirati and resident doctors, nurses, and allied health professionals. In addition to hands-on training, the MAU outlines joint research initiatives, faculty exchanges, and continuing education programs. Health leaders hailed this academia-clinical linkage as an investment in human capital that will ultimately elevate patient care quality in the UAE. Qatar expansion of urgent care services. Qatar's primary health care corporation, PHCC, continued to broaden its service offerings. Following recent openings of urgent care units, PHCC announced that Al-Wajba Health Center would now host a new urgent care clinic for adults and children, bringing the number of PHCC urgent care centers to 13 nationwide. The clinic, effective August 28, operates in the evenings and on weekends to handle non-life-threatening but urgent cases, offloading pressure from hospitalers. This reflects Qatar's ongoing efforts in decentralizing acute care and improving community-level access. This development was just prior to the current week, highlighting Qatar's sustained focus on timely care delivery. Saudi Arabia, new hospitals on the horizon. Saudi officials reiterated progress on their massive healthcare infrastructure expansion. The kingdom is on track with plans to open 5 new hospitals by 2025, adding nearly 1,000 beds across Riyadh, Makkah, Hale, Rijal Al-Mar, and Daran al-Janoub as part of a SR260 billion investment in health and social development. These include specialized facilities such as a dedicated mental health hospital in the capital, note, previously reported. During the week, Health Ministry sources emphasized that these projects, alongside new emergency centers, cancer centers, and dialysis units, will significantly boost capacity and access. Such expansions align with Saudi Arabia's Vision 2030 goal of raising hospital bed density and engaging private sector providers. While the target openings are a few months out, the current period has seen tenders finalized and construction milestones met. Egypt, hospital upgrades and quality push. Egypt's Ministry of Health highlighted improvements in public hospitals as part of its 100 Days of Health campaign. Over the first half of 2025, public hospitals delivered over 30 million services to citizens, and the government is investing in refurbishments of emergency departments and intensive care units in high-need governorates. This week, officials reported progress in installing new diagnostic equipment, CT/MRI, at several general hospitals and in expanding the supply of essential medicines. Additionally, Egypt's drive for hospital accreditation saw a boost. Multiple hospitals in Cairo and Alexandria are undergoing assessment to meet Joint Commission International (JCI) standards, aiming to raise the quality of care to international benchmarks. Finally, let's close out with population health management. Egypt, 100 Days of Healthy Lives, National Campaign. Egypt is aggressively pursuing a population-wide health initiative known as the 100 Days of Healthy Lives campaign, now in its 3rd edition. Launched on July 15, this campaign provides a broad package of free health services across the country. In just the first 49 days, the Health Ministry delivered over 73 million free medical services to citizens, an astounding reach that includes clinical examinations, preventive screenings, chronic disease checkups, and treatments. Dozens of millions of services have been rendered via primary care units, public hospitals, specialized medical convoys, and presidential health initiative programs. The campaign also integrated health education, with outreach teams bringing wellness advice to more than 84,000 people in public venues. This massive undertaking exemplifies population health management in action. By mobilizing multi-sector resources, 12+ health sectors participated. Egypt is strengthening its health system's efficiency and striving for universal health coverage. The Deputy Prime Minister of Egypt emphasized that such proactive national drives are boosting system performance and accelerating progress toward UHC and better health outcomes. GCC, shift to proactive, data-driven care. Health systems in the Gulf are rapidly embracing population health management, PHM, approaches to address rising chronic disease burdens. In countries like Saudi Arabia and the UAE, the traditional reactive, episodic care model is giving way to a proactive, evidence-based paradigm focused on prevention, care coordination, and value-based outcomes. Regional analysts note that visionary health reforms and new financing models, e.g. Saudi's healthcare clusters and DRG payment systems, are spurring PHM adoption. Concrete examples include Saudi Arabia's use of data analytics and AI. King Fahd Medical City's AI-driven chronic disease program enabled early interventions that cut hospitalizations for chronic conditions by 33%. Meanwhile, national electronic health record exchanges, Abu Dhabi's Malafi and Dubai's Nabid, and even pilot projects like Oman's blockchain health records are improving information sharing and reducing administrative costs. These technologies allow risk stratification of populations and more efficient management of high-risk patients. Additionally, government policies are actively encouraging a value-based care mindset, shifting incentives from fee-for-service to outcomes, which supports PHM frameworks. Overall, the Gulf's considerable investment, Saudi now allocates 5.7% of GDP to health, UAE 3.5%, is expected to further propel the region's capacity to manage population health needs at scale. Bahrain National Health Insurance and PHM. In Bahrain, authorities are in the advanced stages of rolling out the Sehati National Health Insurance Program, a cornerstone reform aimed at enhancing population health management. Set within the National Health Plan 2016 to 2025, Sehati will guarantee all citizens and residents access to a basic package of high-quality care while allowing choice of public or private providers. By fostering competition and optimizing resource allocation, the program seeks to improve health outcomes and equity. As Bahrain transitions to this insurance model, it is also implementing robust PHM tools, including a national patient registry and integrated data systems, to monitor health indicators and guide preventive services. The Supreme Council of Health in Bahrain has emphasized how Sehati, combined with the new digital health integration, will enable a more coordinated approach to managing chronic diseases and preventive care for the entire population. Bahrain's holistic vision reflects a broader regional understanding. Effective PHM requires not just tech and data, but also aligning financing mechanisms, like insurance, and governance to incentivize prevention and continuity of care. Let's summarize this week's review. This week's Middle East health developments reveal a sector in dynamic transition. Key trends include an intensified focus on prevention and system-wide reforms, paired with significant advances in medical innovation. Gulf states are aggressively implementing policies to modernize healthcare delivery, from Kuwait's tough eligibility rules and Oman's school health program to Bahrain's impending national insurance and Saudi's digital overhauls, all aiming to boost efficiency, access, and quality. Technology is a linchpin of these efforts. We saw Saudi Arabia harnessing AI to streamline practitioner licensing, while Bahrain and others invest in unified e-health platforms and data-driven care management. In parallel, the region's life sciences and biotech landscape is maturing. Qatar's leap into genomic newborn screening and Israel's organoid breakthrough highlight how Middle Eastern institutions are contributing to, and in some cases leading, cutting-edge research with global implications. Joint ventures, such as Egypt's Vaccine Production Alliance and Jordan's Biosimilar Partnership, also underscore a strategic push to localize pharmaceutical capabilities and reduce dependency on imports. At the same time, formidable public health challenges persist, especially in conflict zones. The Gaza Strip's unfolding famine and rare disease outbreaks offer a sobering counterpoint to the region's high-tech aspirations, a humanitarian crisis demanding urgent attention even as local neighbors like the UAE deliver aid convoys to support Gaza's collapsing health system. In Yemen and Sudan, infectious disease outbreaks, cholera, remind us that basic needs and health security can deteriorate rapidly without stability and international support. These crises have galvanized a sense of regional solidarity, evident in joint campaigns and cross-border cooperation in aid and expertise. Looking ahead, the convergence of wellness promotion, population health management, and digital innovation is poised to reshape Middle Eastern healthcare in the long term. Governments are increasingly adopting proactive approaches, which should bend the curve on chronic disease burdens and improve resilience to future pandemics. The emphasis on healthy lifestyles and preventive safety indicates a cultural shift towards viewing health as a collective societal responsibility. Executives can expect continued investments in health tech startups, telehealth expansion, and AI integration as the region strives to leapfrog into a new era of smart healthcare. In summary, the week showcased a twofold narrative. On one hand, bold initiatives and innovations driving Middle Eastern healthcare to new heights, on the other, ongoing battles to secure fundamental health needs in areas of crisis. Navigating these dual realities will require sustained leadership and collaboration. However, the momentum in policy reform and innovation seen this week provides cautious optimism that the region is building a stronger, more equitable health future, one where lessons from adversity and triumph alike will shape a healthier tomorrow for all. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.